day, everyone. I am Adrian Lapu-os Patricio. I am a registered social worker. Presently, I am connected with Cadiz District Hospital as a medical social worker. So my study is entitled Awareness in the Mental Health Law of Registered Social Workers in Negros Occidental. So to give you a quick background about this study, mental health is the state of an individual's well-being. Mentally healthy individuals realize their abilities, cope effectively with the everyday stresses encountered in life, show resilience during extreme events in life, perform efficiently, and participate in the community's development. The global saddle of mental health issues is enormous, underappreciated, and mostly not fulfilled. Among Asian countries, discussing mental health issues is a taboo within the community. In the Time to Change campaign of Mira Shal, mental health issues are stigmatized within Asian community. The patients face embarrassment and public alarm whenever they are found out to suffer from mental health issues. In the Philippines, mental health has also remained a misunderstood topic. According to Gingrich, Filipinos tend to classify people with dissociative disorders or any mental health issues as being possessed by spirits rather than being acknowledged as having psychological disorders. In the local context, Negrenses are proven to be fanatics of faith healers. The qualitative study regarding Soranjo healing in Negros Occidental showed that province residents firmly believe in the ability of the Soranjos to treat intellectual impairment before seeking primary psychiatric support. Thus, it also revealed that Negrenses' socioeconomic status has also affected their mental health seeking behavior. Presently, the government officials are taking action on the issue. Last 2018, President Rodrigo Duterte signed the Philippine Mental Health Law. However, despite 2 years after the mental health law was passed, there is still a dearth of studies on the awareness of the mental health law. Also, most of the studies conducted focus on mental health in general. This study is purported to assess the awareness on the mental health law of registered social workers in Negros Occidental in the areas of general provisions, psychiatric, neurologic, and psychosocial services, as well as to evaluate the mental health services rendered by social workers in the educational institutions, community, hospitals, government agencies, and non-governmental organizations. The findings of the study will provide a baseline information in creating mental health law advocacy for social workers. So as for the methods employed in the study, so descriptive comparative approach was applied in order for us to have a comprehensive and a detailed assessment on the awareness of the mental health law of RSWs in Negros Occidental. So using stratified random sampling, 160 registered social workers in the province participated. 90 social workers from city or municipal social welfare and development office, 40 social workers from non-government organizations, and 30 social workers from hospitals. So for the data were gathered using the researcher-made instrument validated by 5 experts in social work and psychology. The said instrument was also subjected to reliability testing. So for the analysis, mean, standard deviation, and Mann-Whitney test and Kruskal-Wallis were used to analyze the data. So let's proceed with the results and discussion. Awareness in the mental health law of registered social workers in Negros Occidental. So the areas covered includes general provision, psychiatric and neurological services, and psychosocial services. So registered social workers in Negros Occidental are actually very aware of the mental health law, specifically on the areas covered by this specific study. However, if we look into the details of the statistical reports, we can infer that the social workers are much more aware and familiar of the psychosocial services. It only shows that social workers are aware of are familiar of the limitations and boundaries when it comes to mental health service delivery. So now social workers can only offer limited things. Thus, now upon their assessment that it is beyond their professional practice, they actually refer it to more experts. So one of the distinct attributes of the social work profession is its attachment to the psychosocial interventions. In the helping process, it is always considered that the individual is being seen as a biopsychosocial spiritual well-being. Thus, we don't only intervene on the individual aspect alone, but rather we intervene on the individual and the environment, because we always see that the individual will always be part of the environment, and thus the person in environment context or ng perspective shall be adhered by the social workers. So the services included according to the stipulations of RA 11036 under the psychosocial interventions includes home care services, referral to experts, na individual, family, and community ng education. So this actually now revolves within the expertise of the social workers. Those that requires medication planning, now rehabilitation, are actually referred to psychologists and neurologists. So now we are all in wonder why social workers are still aware on the psychiatric and neurological areas. So social workers stand in the front line of mental health service delivery. Most of the service users, mental health service users, first go to the agency social workers because they are available in the public for now, in the public and very accessible. Most of our psychologists, psychiatrists, or neurologists, they are practicing in private. Thus, our Filipinos now have to spend monies in order to avail their services. And most of the time, social workers, they go to the hinterlands, they go to the outskirts, they are conducting home care now, home visitations in order to deliver the social services. And sometimes that's the time that they discover that some of the community members are really suffering with mental disorders. Thus, upon assessment or evaluation, that's the only time that now that they refer it to some experts, and thus social workers will only give financial support to these now people. So psychosocial services. Now, the results of this study was actually affirmed by Burasa. Now, wherein a study revealed that the social work profession was actually more connected with the psychosocial interventions. It was actually rooted on the history of the profession. Mary Ellen Richmond discovered the scientific approach towards problem solving, that we need to intervene not just in the individual but also in the environment. Thus, Harriet Bartlett, now framing from Mary Ellen Richmond, now created the person and environment theory, that the individual impacts the environment and the environment also impacts the individual. So as for the general provisions of the law, now it is also important that the social workers are aware of the specific aspects, because though they don't have to memorize the specifics of the general provisions, but they have to internalize the context or the components of the general provision, because it will guide them in the service delivery and in framing their activities related to mental health. So it is still very important. So let us proceed with a significant difference in the awareness of the mental health law of RSWs in Negros Occidental when grouped according to age and length of service. So Mann-Whitney U test was used to determine the significant difference in the awareness of the mental health law of RSWs in Negros Occidental when grouped according to age, length of service, and educational attainment. There was no significant difference in the awareness of the mental health law of RSWs in Negros Occidental when they are grouped according to age and length of service. But if we can see into the statistical details, we can see that older social workers and those who have served longer in the organizations are actually exposing much higher awareness compared to their younger subordinates. So it is very understandable and agreeable, because most of the time, the older social workers or those who have served longer in the organizations are the ones who are being sent as a representative in the training seminar when it comes to the new activities or now policies being applied in our country, and they will be required to just re-echo it to their younger subordinates. So also, older social workers and those who have served longer in the organizations have mastered the organization's vision, mission, or ng objectives and goals, and also the services of the organizations. And of course, because they have been serving for a long time in the organization, they have mastered what they are doing, and actually they are making themselves better to become better examples to their younger subordinates. So as for the significant difference in the awareness of the mental health law of RSWs when they are grouped according to educational attainment and settings, Mann-Whitney U test was used to determine the significant difference in the awareness of the mental health law when grouped according to educational attainment. Thus, there was a significant difference in the awareness of the mental health law. So as we can see, those who have graduated with master's degree in social work are actually much now exposing a much higher awareness of the mental health law compared to those who just graduated with BS social work. So now it was affirmed by the results of the study conducted by UDEN that now education possesses a higher or greater awareness towards specific things. And the Northwestern University in America actually further affirmed the results of this study, that if you obtain the master's degree, you will have you will develop apt and specific abilities and expertise towards your job. So that's why most of our government offices, non-government organizations are actually encouraging their employees to pursue higher educations or pursue their master's degree or doctorate degree. So on the other hand, Kruskal-Wallis was used in determining the significant difference in the awareness of the mental health law. So there was no significant difference in the awareness of the mental health law of registered social workers in Negros Occidental when they are grouped according to setting. So there was no significant difference. But if you can see in the table presented below, the government and NGO social workers are actually positing very the same level of awareness. But if you can see the hospital social workers, they are exposing a much lower awareness compared to these two agencies. So it is very understandable because I, as a medical social worker myself, we are very burdened with a lot of clients. Every day we are catering at least 50 clients per social worker. So every time we are confronted with a client having mental health issues, we actually refer it to the psychologist or psychiatrist available in the medical unit or medical facility. So now also NGO social workers. So most of the NGO social workers, they are employed in the agencies or foundations that caters to the needs of the abused children, abandoned children, sexually abused women. Thus, it is imperative that they must be aware of the mental health law or mental health services. It's because it is one of their primary services that they offer to their clients. And government organization social workers, it is given that most of the time when we have new policies or new services, it is them who are being sent to train or to attend a seminar because they will be the one who will spearhead the service delivery. So it is no wonder why NGO social workers and government social workers are more aware compared to the hospital social workers. So as for the mental health services rendered, individual and family counseling, case study or case management, stress debriefing, psychological first aid, and mental health education. So these are the mental health services rendered by social workers in educational setting and non-government organizations, government organizations, and community. So as you can see, there was no rehabilitation, medication planning because social workers are aware of the limitations and boundaries when it comes to mental health service delivery. So this is a very crucial job and we should know our place. So for the conclusion, the very high level of awareness of registered social workers in the mental health law gives assurance and affirmation to every Filipino that mental health services and professionals in our country, particularly the social workers, are vastly improving and developing. Mental health law was just signed 2 years ago. With high awareness of mental health professionals, it can be expected that the law will surely have positive impacts and contributions in the promotion and protection of every Filipino's mental health. So recommendations, RSW may use the findings of the study to enhance and improve mental health services they render. Also, orientation or education of social workers with regards to the social welfare policies must also be taken into consideration so that they will be more aware and cognizant of the roles they play in the effective and efficient implementation of the law. The social welfare agencies may provide a safe avenue and be a source of hope for mental health clients. As such, the services rendered to the clients with mental health concerns should be encompassing and responsive to the needs. Moreover, it is also recommended that the agency shall take part in educating the public on mental health and ending the stigma of the mental health issues. So future researchers may go over to the evaluation of the awareness of the Philippine mental health law by other professionals, and of course, pursue a qualitative study that would scrutinize the awareness of the processes, concepts, methodologies in the law, and their personal experiences is also recommended. So for the proposed mental health law advocacy plan, so these are the components of the advocacy plan. So more likely, it is more on the mental health law awareness na harnessing their expertise in case management, in conducting case study, in conducting counseling and psychological first aid, a webinar on mental health education, and promotion and strengthening of mental health for future social workers. Thus, we have to integrate the social work and mental health to the curriculum of BS and MS social work in University of Negros Occidental Recoletos. So the study significantly contributes to the few existing literature on the awareness of the mental health law of RSWs. The findings of the study will be beneficial for RSWs in the province in terms of enhancing their quality of mental health services that they offer. The research-based information will also help them evaluate their awareness of the mental health law. Likewise, this study will provide information for future researchers to work on the areas that have not yet been tackled in this study, such as the mental health law awareness of professionals and countries' responsiveness to mental health services. So these are the references cited. So thank you very much for listening. Thank you, and may God bless us always.